Hi, my name is Gislayne. Today I'm going to talk about long-term use of Ticagrelor in patients with prior myocardial infarction for my medical English class. Definition: Myocardial infarction is a global problem. It occurs when there is a sudden decrease in coronary flow as a consequence of a thrombotic occlusion of an artery, leading to necrosis of myocardial tissues after prolonged myocardial ischemia. Practice guidelines in the United States and Europe currently recommend treatment with a P2Y12 receptor antagonist for up to 1 year after a myocardial infarction like the Ticagrelor.
Myocardial infarction, commonly referred to as heart attack, is the sudden death of part of the heart muscle due to loss of blood flow. This occurs when one of the coronary arteries, the arteries that supply blood to the heart, is blocked. The blockage is commonly due to atherosclerosis, cholesterol plaques or fat deposits on the wall of blood vessels. As the plaque builds up, the vessel becomes narrow, restricting blood flow. Under stress, the plaque may rupture. This triggers formation of blood clot on top of the plaque, leading to complete blockage of blood flow. When this happens in the coronary artery, the downstream patch of the myocardium dies from lack of oxygen. Weakened heart muscle may disrupt electrical activity of the heart and subsequently cause cardiac arrest. Coronary angioplasty is a non-surgical procedure used to open narrowed or blocked coronary arteries. It can also be performed as an emergency treatment for myocardial infarction. The first part of the procedure is to localize the site of blockage. This part is called cardiac catheterization. A guiding catheter is inserted through the femoral artery at the groin and threaded all the way to the aorta. The tip of the catheter is placed at the beginning of the coronary artery to be investigated. A radio-opaque dye is injected through the catheter into the coronary artery. This enables real-time visualization of the artery using X-ray imaging. A narrowed part of an artery would appear as a bottleneck on an X-ray image. After the location of narrowed artery is identified, angioplasty can begin. A guide wire with a deflated balloon is inserted and pushed to the location of blockage. The balloon is inflated to crush the plaque. At the end of the procedure, the balloon is again deflated and removed together with all catheters and guide wire. In some cases, a stent is inserted together with the balloon, inflated, and left in place of the plaque to keep the artery open permanently.
Applications in medicine. The study Pegasus-TIMI 54 demonstrated that long-term dual antiplatelet therapy with aspirin and ticagrelor reduced the risk of major advanced cardiovascular events, with an accepted increase in the bleeding in patients with prior myocardial infarction. While much of the discussions around our prolonged DAPT has been focused on step-down patients, patients with prior MI without prior coronary stenting comprise a clinical important subgroup.
At ACC 15, simultaneous publication in the New England Journal of Medicine on the data from Pegasus-TIMI 54. And so I figured we probably should talk about this a little bit. So I'm with Paul Spittle, who is the Vice President, Cardiovascular and Respiratory for AstraZeneca. This is officially long-term use of Ticagrelor in patients with myocardial infarction. Now, I confirmed this, my understanding of the history, so let's talk a little bit about where we are in terms of where we've been. This whole thing started, the first was Plato, right?
Correct.
And that was like the first series.
Yeah.
And now we're moving on to Parthenon. Remind us about how these two are different.
Yeah, okay. So, the Plato study looked at post-ACS patients. So it's immediately after a heart attack, and then looked at Brilinta, Ticagrelor plus aspirin against Clopidogrel plus aspirin. And it followed patients for 12 months. So it was the initial post-ACS population and treatment out to 12 months. Where Pegasus differs, it takes a different cohort of patients. So it's looking at people who had an event at least 12 months previous, and then they're already on aspirin, and you add Ticagrelor on top of that and see whether Ticagrelor plus aspirin can make a difference to outcomes. Primary endpoint was cardiovascular death, stroke, and MI. And the great news, I think, for all concerned really, is that both the doses of Ticagrelor studied in this actually hit the primary endpoint. So we did see a significant reduction in the primary endpoint composite.
Now, were there any geographic variations that caused raised eyebrows, or anything in the data that you're looking at going, we need to look at that a little more closely?
Yeah, no, the headlines at the moment, I think the results are pretty much entirely as expected, but that's still a great thing because you always hope for good results. Every time you do a clinical trial, you're always taking a risk because you don't know how it's going to play out. And I think that's one of the brave things about AstraZeneca. When you look at the overall Parthenon program, we're asking a lot of tough medical questions and seeing how Brilinta stacks up against that. But in terms of the subgroups, whatever way you look at it, really, it was very, very consistent. There was no heterogeneity in any particular group, whether it be region, gender, whatever you look at, it was very, very consistent.
And this is for a year?
Actually, the treatment, the median treatment was 33 months. So the minimum ran from around about 17 months, the longest was 46 months. But for most of them, it's around about the 3-year mark.
Okay. Now, in terms of these other Parthenon studies, so what are the other questions that you're looking at?
Yeah, absolutely. So, as I say, Plato was post-ACS, Pegasus is post-MI, and then probably in around about a year's time, we should have the readout of Socrates. Socrates looks at patients who have previous stroke or TIA. We then move on to Euclid, which is a study of Brilinta in peripheral arterial disease. And then finally we get to Themis, which looks at patients who have type 2 diabetes. So the entirety of that is called the Parthenon Clinical Trials Program. It's actually the largest clinical trials program that AstraZeneca have ever conducted, in total in excess of 80,000 patients. Pegasus itself, by the way, is the largest single trial that we've ever had. That was over 21,000 patients.
I love we're up to TIMI 54 now.
TIMI 54, that's the one.
I think it's great. And there is a lot of information from ACC 15, and you can imagine. Please go to acc.org, where you can see all of the different coverage from this meeting. And you can also read about it in the special supplement to Cardio Source World News, where I'm Executive Editor Rick McGuire.
Pros. Ticagrelor is a potent reverser bleeding directing P2Y12 receptor antagonist. The efficacy of Ticagrelor over clothianidase is consistent. That reduced further the risk in ischemia events in the populations in the first years after acute coronary syndrome.
So I'm presenting here is a subgroup analysis of the Plato study. So it's just to give you a background, the Plato study tested the hypothesis that a more potent P2Y12 receptor inhibitor, Ticagrelor, was more effective than Clopidogrel in reducing the composite of death, MI, and stroke in patients with acute coronary syndromes, a broad patient population. And in that study, prior intercerebral bleeding was a contraindication for the study, but patients with prior stroke or TIA were accepted in the study. And that is a very important patient population because it's a patient of high risk of ischemic events and bleeding events. And this population is fairly large. It's more than 1,000 patients. They have clearly a higher risk of all events that we recorded, mortality, the primary composite, all ischemic events and bleeding events, of course, as you would expect. But interestingly, when we look at the randomized treatments, Ticagrelor versus clopidogrel, there were very favorable trends for Ticagrelor. There was a consistent benefit of the primary reduction of the primary composite endpoint, consistent with the overall trial. There was a consistent reduction in cardiovascular mortality and overall mortality, and there were no trends towards increased bleeding risk in these patients, neither overall bleeding risks or intracranial bleeding risk. So it seems effective also in this high-risk population, and it appears to be safe. And my conclusion is that if indicated, patients with prior stroke or TIA should not be excluded for Ticagrelor.
Issue played in Ecuador. In Ecuador, cardiovascular diseases are the main cause of mortality in the hospital of Armored Forces Specialty Number 1, Quito, in the period 2015 to 2017, registered that in patients treated with that cardiovascular death and acute myocardial infarction were significantly reduced when consuming the medication for a period of 2 years. But 8.3% of the patients had late complications with ticagrelor plus aspirin, while 3.3% in those who were treated with chlorotropin plus aspirin. Conclusion. In conclusion, the long-term use of aspirin and ticagrelor has dual antiplatelet therapy that is beneficial in patients with previous myocardial infarction because it reduces thrombotic events even if they have not been treated with stenting.